All right, on the topic of recognizing signs of relapse as seasons change, from your perspective, how does the change of seasons, especially summer to fall, impact a person's recovery journey?
Yeah, seasons, I think it just depends also for the person, what triggers and how those seasons and that time frame might impact them personally. Summer is hard because a lot of folks are having barbecues and outside, and there's a lot of opportunities for use. The weather's not obviously an issue, so I think that time of year can really be tricky for people. um, and then, I'm sorry, did you ask me about fall?
Just the transition from summer to fall.
Oh, I'm sorry, I misheard you. Yeah,
Okay.
so summer to fall. I think just what I said too, of like it just depends on the person, and sometimes the stressors too, going back to school, and then I think just also people who are susceptible to seasonal depression, where like the days are getting shorter. It's getting colder, and so a lot of people that suffer from a substance use disorder often suffer from depression. And this definitely, the season changes of going from sunny, warm weather to fall and winter can be a difficult transition where people might start to notice their mood changing. And those things can lead into isolation and depression that could set somebody up to be at risk for relapse.
Speaking of depression, like what kinds of emotional or physical shifts could we potentially be seeing in patients this time of year as we, transfer from being outside as much as possible to like, stuck indoors?
Yeah. I think it's hard for some folks to just to want to leave, and can get really isolated. And so those kinds of behaviors too, just kind of being withdrawn, or oh, it's cold outside, or it's not as easy to get maybe from point A to point B when the weather changes. And so I think just seeing a lot of isolation, shifts in people's moods if they seem a little bit more down, or just have a lot more focus on like negativity, and just kind of withdrawing a little bit. I think those are definitely things that we can see as part of like the shift and changes with that.
What are some other potential early warning signs that someone may be heading towards a relapse?
Mm, yeah. Well, for folks that, just to kind of going back to again, folks that tend to be more withdrawn, who maybe aren't changing some of their circle of people or the places that they're going, if they're kind of doing some things that could really potentially put them at risk for a relapse. Hanging around people they used to hang around, they're going to places they used to. Again, some of those shifts and changes in mood or behavior. And then part of the risk too is if there's significant changes and life happens, of if they just don't have enough coping skills or a good foundation to deal with a big change or a certain loss. That could be really hard for people to kind of maneuver through, and that could set them up to want to go back to relapse as a familiar way to deal with life when things are tough.
I think something that's very positive about BrightView is, we don't punish someone if they do relapse. It's a part of the process.
Yes.
So, from your perspective, how can BrightView help someone who's relapsed or feels like they're about to?
Yeah. One of the things I think we do really, really well is just engaging patients and building that relationship. We obviously don't come from a punitive place, or, finger wagging if somebody's relapsed or they're not doing the things to help them prevent relapse. We really approach our patients with compassion and kindness, and, just a concern. And so building those relationships with patients, I think is, something, like I said, that I think that we do well, to say, hey, we're invested in you, normalizing how they feel, and also just to really try to reduce the stigma and the shame that people might experience if they've had a relapse or might be headed towards one. That they know that they're going to come to us, and that we're going to provide that non-judgmental safe space for them just to be who they are and where they're at. And we truly come from a place of like, we are here to help you. We're not here to hinder you in the process or have some judgment about it. I mean, these are people who have a substance use disorder, and it's a disease, so treating it as such versus just a moral issue of choice and things like that.
I think one of the best things that came out of the pandemic was our use of virtual meetings. And I know, especially on the behavioral health side, sometimes it's more convenient for a patient to hop on a computer and talk to someone. Convenience doesn't always make it the best, because I've talked to some patients who they need that in-person face-to-face. So as the seasons are changing, if someone is worried about depression or relapsing, can they use that as a tool if they can't get to a center, or what can they do? Because we talk about how people shouldn't spend so much time alone, because that usually,
Yeah.
you know,
Yeah. I think it's something that's really good for the clinician to, with the patients that they're working with, to kind of use that clinical judgment, because it's going to vary from person to person. So what might be best for one person might not work as well for somebody else. And depending on the variables and the dynamics of what that person is experiencing, and or the concerns around that, so it's definitely going to vary. Having the flexibility to do telehealth is also a stress reliever for a lot of patients, that they're not having to spend as much time on site or coming to the center multiple days a week, especially if transportation is an issue. And I think we just try to look at it from a standpoint of, do we have concerns about this patient? Do we feel that they're at risk? Is this somebody that we want to have eyes on, like when they come in the center? It's like, hey, we want to see you, because being able to see somebody via telehealth is helpful. Like, it is an avenue for being able to provide therapy services, but there are things that just can't substitute seeing somebody in person and being able to read their body language and have that interaction to get a better sense of what is going on with that person. And I think that is also just can be more meaningful for that person who comes in too. So the therapists are usually asking questions about depression, especially when they do their treatment plan update. So we have some assessment tools and screening tools to kind of gauge where people are at, like as far as risk and their mood. And those things are also really helpful for us to kind of make some of those determinations about, who's going to be best served in person and who is going to be best served having some telehealth components.
as part of the assessments this time of year, are there different things that your teams are looking at or looking for, since there may be different triggers as the seasons change versus as we're moving from spring to summer? Are there anything that they're specifically looking out for, or is it pretty much the same?
Yeah, I think there's just always going to be a constant with assessing and just kind of evaluating where patients are at. And those are things that are on us to kind of own and make sure that we're paying attention to. We do have groups that will also talk about, might be a holiday coming up, or some, things that we're all experiencing that might be important to talk about in a group setting or for an individual person. Sometimes it's not just the weather. Sometimes it's, again, it's holidays. It could be, time of year around loss and grief, that might be hard for a person. So I think our best approach is just to get to know the patient and build that relationship, so we can identify, hey, this time of year is really tricky for this patient, or this day or whatever, the transition through summer to fall or fall to winter and so on. I think that ownership is on us to really get to know the patient and individualize what somebody needs. But I think there are just universal things that we identify that every patient can benefit from having as part of the conversation.
Going along the lines of depression, I know I was definitely guilty of it in high school and college. As summer's over, fall's here, summer relationships are coming to an end, it's getting darker earlier. So I always felt the depression felt heavier this time of year. So why do
Yeah.
you think so many people feel a mood shift, that it feels heavier specifically this time versus how they may handle a situation 6 months ago?
Yeah. I mean, our environment plays such an impact on how we feel emotionally. I mean, even if we're inside, right? Like even in an indoor environment of like what that looks like, you know, there's research to show that, like having plants and greenery or certain colors, things like that, even when we're inside, can impact somebody's mood. And definitely on the scale of weather and, the amount of sunshine we get, or, the days are getting shorter and, things like that. So I think that's pretty much part of the reason why. I think a lot of people talk about, needing some of that sunshine to kind of like re-energize them. And so when the days get shorter and there's a lot more darker and just a lot of cloudy days, I mean, I think that's something that everybody can potentially experience some shift in moods and change. But for our patients, just having a substance use disorder, on top of that, can really kind of put them at risk to be more sensitive to those seasonal changes, and they might need some of that additional support where maybe somebody like you and I might have some ways to cope with that, even if we identify like, oh, I don't love this change, I'm missing summer's leaving, but um, having some ways to cope with those changes, and things we can do to kind of substitute that, or things that we know that can help improve our moods, or social groups or certain activities or things that we know like we have to pay attention to. And so if you don't have that kind of baseline and that foundation, that can make it really hard too. So
Is there a difference between seasonal affective disorder versus like being typically sad or just fatigued? How do you know that that's what a person may be suffering with the seasonal
yeah,
affective disorder versus just typical sadness?
yeah. Well, I mean, as far as like from a diagnostic standpoint, there are differences. And so, somebody who has depression, a major depressive disorder, those symptoms are going to look a little bit different. We look at frequency, and severity and timeframes with those, where seasonal depression might just really be related to seasonal changes, and where somebody's like, hey, I don't have the same experience when the weather is different. It just really is something that they have a hard time uh, seasonally, versus somebody who might be suffering from depression. They can experience episodes of depression regardless of what's happening. So regardless of seasonal changes, having that be a difference. Hope I'm explaining that in a way
Yeah.
that makes sense. Yeah.
Are there signs people should look out for that might indicate that what they have is more than just the fall blues?
Yeah. I think it's hard for us to always see those things for ourselves. We have a lot of blind spots, and sometimes it's, needing that outside person to kind of help us better understand of like what maybe they're seeing. So even if it's a friend or a loved one, being able to have those conversations with them too, to be open up to their feedback. But also just, if somebody senses that it might be more, it's good to go talk to someone, go talk to a counselor, go talk to a clinician, a medical doctor, to talk more about their experiences and their symptoms, and to have somebody in a professional capacity be able to help them make that determination.
I know someone in active recovery, they have a lot of guilt or they feel ashamed about a lot of stuff, so they may not want to talk about their depression. So what would you say to
Yeah.
someone who does feel ashamed to talk about depression, especially during their recovery?
Yeah. Shame is just hard in general. And it's something that I think all of our patients, experience. There's such a strong correlation between shame and substance use. At least that's part of what the research has shown, especially with the stigma of society and people feeling a sense of judgment for having a substance use disorder, feeling misunderstood or feeling labeled, where we've had people who have said, like, I don't want my employer to find out, or feeling judgment from, friends and family. And so, really just making sure that we're not pressuring the patient to share more than what they're comfortable with, and being able to explain like our role and our part in their treatment. And the reason why we ask these questions, it's not to be invasive in any way. It's like, this is part of like our responsibility and our service to them, to be able to make sure that we're giving them a holistic approach, that we're giving them that comprehensive treatment, because substance use impacts somebody physically, mentally, emotionally, and spiritually. And so I think it's just trying to create that safe space for somebody to feel that they're not going to be judged for what they might be experiencing. And from a psychoeducation point too, it's really important for our staff to also talk about, that, and normalize that people that have a substance use disorder often experience depression, often experience anxiety. And they might think like, oh, I thought that was just me. I thought something was wrong with me. It's like, oh no, a lot of people who have a substance use disorder have this experience. And so for folks to be able to determine, is this substance use induced depression or anxiety? Or is it a true ongoing depression, anxiety? If they have some other things that might, like, once the substance use is away, it's like, oh, I find that I don't feel depressed anymore. I don't find that I feel, as anxious, things like that. And so, and for some folks, they might still be feeling that way. And so that helps us to better understand. But as far as having those conversations with patients, I think psychoeducation is really important, and just explaining the why behind it. And then for us as clinicians, even if a patient's not verbalizing, like if you came into my office and you didn't tell me that you're feeling depressed, but there could be a lot of other cues that tell me like something seems off with David, like how you carry yourself, maybe, somebody comes in and they present, they're not really taking care of themselves hygiene wise. They just, what words they're choosing to use, all these different things. And so I think those are things that we're responsible to pick up on, and kind of further assess from there.
I think it's important to note that anyone that took that first step to even get help or seek recovery, that's huge and should be celebrated and should be nothing to be ashamed of. But speaking of mental health and substance abuse, how does BrightView specifically support patients who are struggling with both mental health issues and substance use disorder?
Yeah, absolutely. Again, I think it's part of the psychoeducation that, the substance use has impact, on our mental health. And, for us to kind of assess to what that patient's need is. And so we have some patients that need more specific mental health. So our team can refer them out to resources in the community. Maybe that person needs more wraparound support or something more specific, where our counselors are primarily focused on the substance use disorder, and we have the understanding and knowing that their mental health is going to be impacted. But we have some folks that need somebody who is going to specifically, work with them on their mental health issues as well. And so referring out to community resources, online resources, and then we have psych providers as well. So we also will try to refer those patients pretty quickly to connect with one of our psych providers, so that way they can get that service from us.
And we've talked about it before, but BrightView addresses both behavioral health and the medical side. So what does healing look like when both conditions are addressed together?
Oh, I like that question. What does healing look like? I think for just folks that are progressing in treatment, is that the healing looks like a lot of stability in how that person's life just is transformative, being able to see some of the outside differences and changes in appearance and like, how they're living their life, but then also just how they're feeling about themselves and being able to talk about how they've coped or how they've managed with things, and that they don't have the cravings anymore, and that the medication piece, if they're on medical assisted treatment, that's something that's helped them to stabilize, and that's something they've been consistent with, but then they've also been able to apply and really benefit from the counseling side of treatment as well. That combination of those two things, I think, are what can really help set people up for success. And so when somebody's really kind of leaning into both of those things, you just start to see dramatic changes in people's life, and depending on where they were starting from, but definitely from the inside out.